Welcome to the Medical Staff Voice Live. I'm Dr. Stan Froswijk, Chief Medical Officer at Community Memorial Health System, and I'm joined today by Dr. Shawn Steen, oncologic surgeon. Welcome, Dr. Steen.
Thank you. Thank you for having me.
Oh, you're very welcome. It's good to have you here. We appreciate you joining us today so our medical staff and community can learn more about your practice. In order to do so, we have a few questions that should enlighten us and clarify what it is that you do in your specialty and a little bit more about yourself as well. First of all, tell me about yourself. Where are you from? Where did you do your training? What brought you to Ventura?
Sure. So actually I'm from Colorado. I went to the University of Colorado for undergraduate and for medical school. So I was 8 years at Buffalo. And in medical school, I met my wife, who's an OBGYN in the community. And we did what's called a couples match and left medical school and went to Baylor in Dallas and did a residency together there. She did 4 years of OBGYN while I did 5 of surgery there. And then I had a fellowship at the John Wayne Cancer Institute, which is a surgical oncology fellowship in Los Angeles. It was based out of the St. John's Hospital, although it was closely associated with UCLA since it was run by the former UCLA surgical oncology department. And after that, we stayed in the Valley for a few years. I actually worked for a while at Los Robles, and then I took a faculty position at the City of Hope, where I was on their hepatobiliary surgery team for about a year and a half to 2 years. And then I was enticed to the community of Ventura to go to the VCMC hospital as their chair of surgical oncology department there. And I've been there for the past 7 years or so doing most of the surgical oncology for the county hospital system, including skin cancers, breast cancers, and abdominal cancers such as liver, pancreas, gastric cancers, and things of that nature.
Well, that's important for both our colleagues and our community to understand that a general surgeon might encounter a cancer. If it's a straightforward one, perhaps they might handle it, but it's not unusual for them to call you in to either take over the resection part, the perhaps dissection part, and maybe even manage the case independently. Is that accurate?
I think the real benefit of a surgical oncology training and a surgical oncology practice is that only part of it is the actual mechanics of doing the surgery. Yes, we are trained in the anatomy and the margins of resection and dealing with big cancers, but a lot of it is the multidisciplinary care. So we understand a little bit more about the way the medical oncologists and radiation oncologists think about things. During our training, we have to read a lot more medical oncology and radiation oncology literature than, let's say, just from general surgery residency, that I wouldn't have known a lot of those studies. So it's a way of us being able to communicate in a team setting with the other treating physicians, such as the medical oncologists and the radiation oncologists. So that's a big part of what we do in our jobs, is actually liaison between the surgery and all of the other treatments when it comes to cancer patients.
Well, that liaison work sounds a little bit like quarterbacking.
Yeah, right, sometimes.
And I can see where that'd be so, because it is common for the surgeon to manage the case after the oncologist and or radiation oncologist have done their part. So I can see where that might continue on as well. You mentioned that your particular interests are in soft tissue, skin, breast. And actually, there's a recent change in our environment that has associated you with Dr. Flynn going forward in a collaboration. Could you explain that a little bit and what the plans are?
Sure. So, so actually the John Wayne Cancer Institute, which is the fellowship that I went to now a little over 10 years ago. Anyway, I was trained by giants in the field of melanoma and breast surgery. Don Morton was the chair of the UCLA Surgical Oncology Department for a long time. He invented the sentinel lymph node biopsy for melanoma. He trained me and unfortunately passed away just a few years after I left. So I was one of the last fellows that had the great privilege of training with him. And Armando Giuliano, who's the current chair of surgical oncology at Cedars-Sinai, was the other attending that we worked with on our fellowship. So we spent a lot of time working with both of those really great physicians. So my focus was always really strong in breast cancer and melanoma coming from that fellowship. I also have a lot of family history of melanoma. I lost my grandfather to melanoma. Part of the reason I went into surgical oncology was specifically for melanoma surgery. So in the first 10 years of my career, I've really attacked every sort of cancer. I pretty much took care of any surgical oncology issue that came my way. And now that Dr. Byrne has retired and asked Dr. Flynn and I to step in to take over a lot of the skin cancer, and Dr. Flynn's actually doing some of the cosmetic surgery too. Anyway, as far as the skin cancer work, I feel that it's something that I've always wanted to focus on and continue the next part of my career really looking at that area also. So it is working out well that we are available and willing and trained, and it's something that I've always wanted to focus on in my career at some point anyway. So the timing worked out well for that.
Yeah, it worked out very well for us, that's for sure, and our community, because the need is very acute right now. It sounds like you had a professional passion for what you do, but also a personal interest as well in light of your family history. The other facet of your particular work is that you spend a substantial amount of your time as Associate Program Director of the General Surgical Residency here at Community Memorial Health System. Is that accurate?
Yes. So, as I mentioned, I was at the Ventura County Medical Center, the county hospital across the street for quite a few years now, 6 or 7 years at least. And about 3 or 4 years ago, we were asked to come in and work with the residents more in the didactic environment here. The residents in the general surgery residency have spent a lot of time clinically at the county hospital with us. And clinically, I think they really enjoy the experience there, and they enjoyed working with myself and Dr. Romero, my partner, who is the actual program director. So we came over to help with the didactics and more of the running of the residency when Dr. Awaziak retired a few years ago from the residency director role. And since then, we've been really involved with teaching the residents, working on research. The research production from the general surgery residents has gone up a lot. They do a lot of presentations at regional meetings, national meetings. They publish a lot of papers. We're working on their scores for their in-service exams, and those have gone up statistically quite a bit in the last few years. So yeah, there's been a lot of good momentum in the general surgery residency. We have a full complement of residents now. They have a 100% board pass rate and a 100% match rate into the fellowships they've tried to get, which, granted, it's relatively small numbers so far, but that's actually relatively unheard of. To have 100%, I don't know how long it'll last, but they're doing great right now.
Well, that sounds wonderful. We're very fortunate to have both you and Dr. Romero here guiding our surgical residents and acting as mentors and models. Thank you. Where is your practice currently located?
Well, I'd say the best way to describe it is I split my time. And I split my time between the county hospital with my practice there, and I split my time at CMH Hospital with my practice here. And the CMH practice is largely out of Midtown Medical Group Clinic, which is in the office building across from the hospital. And I'm also taking over Dr. Byrne's old office, which is on Victoria Street. I don't know the address right off the top of my head, but I think it'll be attached to this video somewhere. Anyhow, we are taking over that office, and Dr. Flynn and I are both working there, and I think CMH will play a big role in how that office is run eventually. But yeah, so the surgeries that I see in those offices are done at CMH, and the surgeries that are done at county are seen there. So I split my time evenly between the two right now.
Well, it's great that the community has that kind of access to you and the specialties involved. So we've talked a lot about your professional interests. Do you have any hobbies, outside interests, or can we only find you in the OR?
No, definitely can find me places other than the OR.
Such as?
So I have 2 boys. They're 8 and 11 years old, almost 9. They love the ocean. I actually spend a lot of time fishing and out boating, and I surf a lot. And
Nice.
so we spend a lot of time out enjoying the ocean. And that's part of what landed me in Ventura really in the long run was coming from Colorado, we love the mountains and we love being outdoors. I always had a passion and a love for the ocean. And I slowly was arranging my life so that I would end up in California. I had selected to go to, say, the John Wayne Cancer Institute in Santa Monica as my first choice for fellowship. It worked out. I was very happy to be there. And we never really left, although we've slowly been working our way closer to the coast in both my practices and our living. And what's great is we both, my wife and I and my children live in Ventura. I actually live a stone's throw away from CMH Hospital. And what I really love is being able to treat the patients in the community that are in the same community that I actually live in, that my children go to school with, that my wife can treat them also. So it's been a really nice experience to live in the same community that our practice is in.
Sounds like a very familiar theme I've heard, so thank you. Well, we lighten up this discussion with our final segment, which is really kind of a stream of consciousness, and it gives us a little insight into who you are as well.
Okay.
It's called This or That,
Uh-huh.
and here we go. Dogs or cats?
Definitely dogs. Yeah.
Early bird or night owl?
I would say an early bird these days as I get older. I just I wake up at 5:30 or 6 and I can't sleep in if I want to. So yeah, early bird these days.
Welcome to the club.
Yeah.
Time machine or magic wand?
Oh boy, I think a time machine would cause all sorts of problems in life. I'll go with magic wand just because the space-time continuum. I don't want to mess it up.
What's worse, laundry or dishes?
Laundry, yes. Being so active, I think I make too much dirty laundry. It's just a constant thing I just can't always stay ahead of.
Skydiving or bungee jumping?
I've never done either, although I would probably skydive first. Yeah, my wife is terrified of flying, so she would never do it. That would definitely be a solo activity.
Well, you kind of gave me a little hint. Ocean or mountains?
Oh, funny, because that's my life, is an even split between the two.
That's beautiful.
A lot of nostalgia for the mountains. Right now, I have a lot of love for the ocean. I mean, I'd honestly answer 50-50. I could go either way. We spend a lot of time in the mountains now. The interesting thing is I tried so hard to get to the beach and the ocean, and my kids love the mountains. And they tell me all the time that they don't understand why we would leave Colorado. We should have stayed there because they love the mountains.
You can't win, can you?
I can't win. So yeah, both.
Casual, sneakers or sandals?
Definitely flip-flop kind of
I
guy.
love
Yeah, mostly.
I'll bet I know the answer to this. Passenger or driver?
I think as the surgeon in me would say driver, right? But I got a mellow side of me that likes to just relax and look out the window and watch somebody else drive, and I can lose myself in my thoughts. So
I can identify with that.
I can give up the wheel once in a while.
Nice.
Yeah.
Okay, this is a superpower question. Be invisible or read minds?
Definitely be invisible. I actually don't think I want to read minds. Most of the time, I think it's better not to know.
Well, those are great answers. Thank you for tuning in to learn more about Dr. Steen. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you very much, Dr. Steen.
Thank you.
You're welcome.
Thank you for having me.